ES College of Nursing, Villupuram. Strive, serve, shine.
Good morning everyone. Myself Prabha, working as an associate professor in ES College of Nursing. Today I am going to explain about the pelvis. First we discuss about the introduction about the pelvis. The pelvis is an important part in the skeletal system. It's not only in the skeletal system, it also used in a obstetrical practice. The knowledge of the pelvis is very essential in the obstetrical practice. And during the time of labor, the pelvis is used to assess the stations and the relationship of the fetus with the pelvis. What are the primary functions of the pelvis? The first one is the independent movements of the body. The pelvis allows the movements of the body like walking, running and sitting. The second function is it acts as a bridge. It transfers the trunk weight to the lower extremities. And the third function, it protects the pelvic organs like uterus, bladder and rectum related organs. And also it is a skeletal framework of the reproductive system. And the final function, the pelvis is especially made for the childbearing. First we see about the bone of the pelvis. The pelvis totally consists of 4 bones, 2 innominated bones, 1 sacrum and 1 coccyx. The first one is the innominated bone. The innominated bone has 3 parts, ilium, ischium and first one is the ilium. It is the uppermost part of the innominated bone. In this, a large flat out part is present, it called as the iliac fossa. The hands placed on the hip, the hand is rest on the iliac crest. In front of the iliac crest, there is a bony prominence is present. It is called as the anterior superior iliac spine. Just below the anterior superior, one more bony prominence is present. It is called as the anterior inferior iliac spine. Similarly, at the back side of the innominated bone has 2 more bony prominence. It is called as a posterior superior and posterior inferior iliac spine. The next one is the obturator foramen. It is an anterior oval foramen present in the ilium. It's called as a obturator foramen. The second one is a acetabulum. It is a deep cup-shaped part. It is composed of 5 parts of the bones. 2/5 of the ilium and 2/5 of the ischium and 1/5 of the pubic bone to form a acetabulum. The acetabulum receive the receive the head of the femur. The next one is the ischium. Ischium is the inferior part of the innominated bone. It consists of body and the ramus. The above it forms as acetabulum and below it forms as obturator foramen. The large prominence is present in the ischium is called as the ischial tuberosity. The ischial tuberosity, while sitting, the body rests on the ischial tuberosity. Behind the ischial tuberosity, one inward projection is present. It called as the ischial spine. During the time of labor, the ischial spine is very important landmark to find out the station of the fetal head. The next one is the pubic bone. It is formed the anterior part of the pelvis. It has a 2 arrow-like projection, superior and the inferior ramus. The pubic bone meet at the symphysis pubis level and the 2 inferior ramus form the pubic arch. Next bone is the next sacrum. One is a sacrum. It is the last bone of the. It is formed by 5 wedge-shaped bones. It is formed by 5 fused vertebrae also. And it has the anterior surface is called as concave and the posterior surface is convex. Through this hole, the anterior surface is smooth and the posterior surface is rough. The posterior surface attachment with the muscles. That's why it's a rough in surfaces. The 4 pairs of hole present in the sacrum, it receives the cauda equina nerve supply to the pelvic organ. And the next bone is a coccyx. It is otherwise called as a vestigial tail. It is formed by 4 fused vertebrae. During the time of labor, the coccyx move backwards to allow the station of the fetal head. Next one is the joints. Totally in pelvis, 4 joints are present. First one is a symphysis pubis. The anterior and the upper and the lower ramus of the pubic bones are formed as a symphysis pubis joints. The second and third is the sacroiliac joints. The sacrum and the innominated bones joins together to form as a sacroiliac joints. And the fourth one is a sacrococcygeal joints. The sacrum communicated with the coccyx. It's called as a sacrococcygeal joints. The next one is the ligaments of the pelvis. totally 4 ligaments are present in the pelvis. First one is the sacroiliac ligaments. The sacrum, right and left sacroiliac joints are attached with the sacroiliac ligaments. The second one is the sacrotuberous ligaments and third one is the sacrospinous ligaments. These two ligaments from the sacrum to the ischial tuberosity and sacrum to the ischial spine. That's why it called as a sacrotuberous ligament and sacrospinous ligaments. The next one is the sacrococcygeal ligaments. The ligaments attached with the sacrum to the coccyx. It called as a sacrococcygeal ligaments, and interpubic ligament is otherwise called as a symphysis pubis ligaments. Two pubic bones are connected with this ligament. The next one is a true pelvis. Below the brim cavity and outlet portion is called as the true pelvis. It is divided as a brim, cavity and outlet. The brim, it is the superior part of the pelvis. It has the 8 landmarks for the pelvis. First one is a sacral promontory. Second one is a sacroalar wing. Third one is the iliopectineal line. Fourth one is the iliopectineal eminence. Fifth one, iliopectineal eminence, superior ramus of the pubic bone, upper inner border of the pubic bone and upper inner border of the symphysis pubis. These are all the 8 landmarks present in the brim. Next one is a cavity, pelvic cavity. The brim superiorly and outlet inferiorly, it forms as a cavity. The cavity is formed by 3 walls, anterior, posterior and lateral walls. The anterior wall is formed by the symphysis pubis and the posterior wall is formed by the sacrum and the lateral walls are formed by the obturator internus muscles. The next one is a false pelvis. Above the brim, the space is called as a false pelvis. The next one is a pelvic diameter. Pelvic diameter divided as a 3 parts: anterior-posterior diameter, transverse diameter and oblique diameter. First one is the anterior-posterior diameter of the brim. The anterior-posterior diameter is divided as a 3: anatomical, obstetrical and diagonal conjugate. First one is the anterior-posterior diameter. It from the upper border of the symphysis pubis to the sacropromontory is called as the anterior-posterior diameter. It is 13 centimeter in length. The second one is the anatomical conjugate, just 1.25 centimeter below from the symphysis pubis to the sacral promontory. It called as an anatomical conjugate. It is 12 in centimeter. The obstetrical conjugate is 11 centimeter. It from the lower border of the symphysis pubis to the sacral promontory. And the third one, obstetrical conjugate, it cannot be measured with the examiner's fingers. It present from the lower border of the symphysis pubis to the sacral promontory. The diagonal conjugate is measured anterior-posterior from the lower border of the symphysis pubis to the sacral promontory. The transverse diameter. The transverse diameter presents between the 2 iliopectineal eminence. It is nearly 11.5 centimeter, and the oblique diameter is extended from the iliopectineal eminence of the one side of the sacroiliac articulations with the opposite side, and sacrococcygeal passes the sacral promontory of the iliopectineal eminence. Then the diameter of the cavity is in circular in shape. It's not possible to measure the size of the cavity. Anteriorly it is formed by 4 centimeter and posteriorly formed by the 12 centimeter. So approximately the cavity is 12 in diameter. Then outlet, it's a diamond in shape. It has a 3 diameters, same anterior-posterior, transverse and oblique diameter. First one is the anterior-posterior diameter. It's a lower border of the symphysis pubis to the sacrococcygeal joints. It is 13 centimeter in length. The coccyx may be deflected backward during the time of labor. The oblique diameter, there is no fixed point for the oblique diameter. It is present between the 2 foramen ovae and the sacrospinous ligaments. It is approximately 12 in centimeter. Then last one is a transverse diameter. It is present between the 2 ischial spine. It is 10 to 11 centimeter. Then 4 types of pelvis in the obstetrics. First one is a gynecoid, second one is a android, third one is anthropoid and fourth one is a platyploid pelvis. Thank you.